Welcome. I am Alex Altman. I'm a part-time clinician with the American University Counseling Center. I'm also their former full-time clinical case manager. And this presentation that's being offered by the Counseling Center today is for students and parents looking to learn more about the process of navigating referrals to off-campus mental health care. We care deeply about the well-being and safety of our students, and we want everyone to be able to get what they need. So if you're interested in seeking off-campus therapy and/or psychiatric services, you've come to the right place, and please stay tuned. Today, we'll go over a brief overview of services at the American University Counseling Center, including what we are and are not able to offer right now, given current operating status. We'll learn how to verify your insurance benefits so you know more about your coverage and what your cost for services is likely to be. We'll go over how to search for providers and how to connect with a provider or multiple providers once you've found the right fit. And we'll go over out of state and telehealth related considerations to be aware of as you're connecting with providers in this COVID-19 world that we're all living in right now. So, first of all, services available through the American University Counseling Center. Due to applicable licensure laws, the Counseling Center can only offer clinical services. That includes urgent care, initial consultation appointments, and ongoing counseling to students who are physically located in the District of Columbia. We are physically located in Mary Graydon 214, but are only offering virtual services right now in accordance with American University's current plan. So services available at the Counseling Center include short-term individual therapy, group therapy, urgent care hours. Those are all only available to students in the DC area, and 24/7 after-hours emergency support, which is available to all students regardless of location. Students can visit our website to connect with our virtual counseling center, and through that platform, we have our clinicians meeting virtually with students through a secure and HIPAA compliant video conference service that works with smartphones, laptops, and tablets. So all you need is an internet connection to connect with us. Our individual therapy services are short-term and time-limited, so students who want or need longer-term therapeutic support might find a better fit off-campus. Students who need therapy more than once a week, or students who need specialized therapy will probably also find that off-campus care is most appropriate for their needs. Students in the DC area can make an appointment for initial consultation or visit our urgent care hours to see if our services might be the best fit for them, and if they're not, we can help with creating a customized referral list and assistance in connecting to the right provider. Students who are located out of state, so not in the Washington, D.C. area, are always welcome to contact us by phone or email to request assistance with finding referrals for therapists or psychiatrists in their area. I wanted to mention we don't offer any psychiatric services through the counseling center at any time, but the Student Health Center on campus does offer these and is operating remotely now also. But students who need frequent or specialized psychiatric care will probably be better served off campus. If you have any questions or want to learn more about the services we have available through the Counseling Center, you can check our website linked in this slide for more information about us, our staff members. Our social media pages are linked on there too. We maintain our social media accounts and our website to regularly include resources related to mental health, including any workshops or special events we might hold throughout the year. So be sure to follow us to keep up with our offerings. The first step in seeking off-campus care for therapy or psychiatry is to figure out how you will be paying for services. So most people opt to use their health insurance, which can cover a good portion of the cost of services depending on your plan and coverage. One important note is that if you're in the process of researching various health insurance options, and therapy or psychiatry services will be helpful or maybe even critical in supporting you while you're at college, it's really important to do your research ahead of time with respect to various options for health insurance, whether that's your current plan, if you're staying on your parents' current plan, or if you're looking at purchasing the AU student health insurance plan through CareFirst. When students and parents don't do this research before coming to school, sometimes they find that their insurance plan doesn't offer mental health benefits, and that can be a really frustrating discovery, especially once you're experiencing mental health related concerns. So we want you to be able to avoid that experience if at all possible. And if you have any questions about health insurance requirements, please don't hesitate to reach out and ask. That would be directed towards the Student Health Center, and they'd be happy to hear from you. You can find more information about health insurance requirements and coverage through the student health insurance plan by going to the Student Health Center website, which is linked here. If you're planning to use your insurance to help cover the cost of therapy, you will want to contact your insurance company to ask some basic questions about your plan and your coverage so you know how much you'll have to pay for services. And there are a few ways that you can do that. So one option is to create an account on your health insurance plan's website. Many sites offer a way to verify benefits and search for providers when you log in. Sometimes you can also get a electronic copy of your card, which is helpful if you ever lose the physical card. You might still want to make a phone call, though, to clarify things because the insurance language in the online documents and brochures and pamphlets can be really complicated and difficult to understand. So most people will choose to call their insurance company using the phone number on the back of your card. There'll be a few different numbers probably, but you're looking for something like member services or benefits. Be sure to block off some time for the phone call as you don't always get through to a representative right away. And when you do get through to someone, make sure to take careful notes on the information you get. Ask for the name and ID number of the representative you speak with, all of that good stuff. If you are on your parents' insurance plan and they're supportive of you seeking services, you could ask them the questions we'll cover in a minute. If you are on your parents' plan and they're not supportive of you seeking services for any reason, you will want to look at treatment options you could pay for yourself. And we'll talk a little bit more about lower cost therapy when we cover ways to search for providers. If you have the AU student health insurance plan through CareFirst, you can visit the Student Health Center's website, like I mentioned, for more information or to compare the coverage with your current plan. Specific information about the benefits and coverage can be found in that link that's right there in the slide. You can also contact them by phone, of course. And from what I know of them, I've been told that people with the student health insurance plan are covered for services outside of the Washington, D.C. area, but you'll want to contact them for more specifics about that. So in terms of questions you will want to ask your insurance company to verify your coverage, here are some of the most basic ones. You'll want to ask if you have mental health benefits through your insurance. Do you have coverage for outpatient care? That would mean outpatient therapy on a weekly basis. There are other kinds of mental health care that could include more intensive options like intensive outpatient therapy or residential care. So be sure to ask about coverage for the services that you need. You'll want to ask about coverage for services either in the DC area or wherever you're located, as well as whether or not there's a limit to how many therapy sessions are covered within 1 year. You will want to ask about mental health deductibles. So a deductible, many plans have deductibles. And that means you have to spend a certain amount of money out of pocket to meet the deductible before your insurance begins to cover your care. For students on family plans, other family members' care can contribute to meeting the deductible, so it's important to know what it is and to ask how much of it has been met so far. You will want to go over if there's any pre-approval or pre-certification for therapy, what that process looks like, how many sessions are approved at a time. That might apply more to higher levels of care, like an intensive outpatient program or residential care. Pre-certification and pre-approval are more common to those settings. But Many of those treatment centers offering those levels of care will also offer to verify your benefits before you would be enrolling or being admitted there. So that might not apply to outpatient care. And you'll want to ask if you need a referral, for example, from your doctor or anything like that. Sometimes that can be common if you are going out of network. You will want to ask about the diagnostic piece. So typically, you need a diagnosis for services to be covered through your insurance plan. And it's important to be aware that once a therapist or psychiatrist makes a diagnosis and that information is submitted to your insurance company, neither you nor your provider is fully in control of what the insurance company might do with that diagnosis in the future. They can, for example, request updates from your provider, refuse to offer coverage beyond a certain number of sessions. This is one reason why many providers make the tough decision not to take insurance. But I think it's less of a concern these days for most people. You might want to ask about which diagnoses might not be covered or if there's reimbursement for a V code. A V code would be a code given by your therapist if you don't meet criteria for a specific mental health diagnosis, but there are still circumstances in your life which are causing you to be clinically impacted. So, for example, you're experiencing a transition or life change or health condition that's hard to that it's hard to adjust to, even if you don't have a full mental health diagnosis. You'll want to ask about the process for submitting paperwork for reimbursement if you're seeing someone out of network. So for in-network therapists, you'll just be responsible for whatever your copay would be, or your co-insurance payment. But for out-of-network providers, typically you pay up front for the service and then you submit the paperwork you get from your therapist, which is usually called a super bill, to your insurance company for reimbursement after the fact. Some providers will assist with this process, but most of them, if they're out of network, will not. And if they don't, then submitting that paperwork for reimbursement is your responsibility. Or your parents' responsibility, depending on your situation. You'll want to know where to mail paperwork to, and if there's an option to do this online securely, which is becoming much more common these days. And you'll probably want to know how long it takes on average for them to get you that reimbursement check in the mail. So how do you actually go about finding a provider? So this is one of the most common questions we get at the Counseling Center from students and from parents. And it makes a lot of sense to have questions and concerns about this process, especially for those of you who don't have any previous experience with it. Fortunately, these days, there are many great and efficient ways in which to search for providers. And as stated previously, if mental health care will be helpful to, or maybe a critical factor in supporting you while you're at college, it's a smart idea to begin researching options for providers ahead of time, even before you come to school. Of course, once you're here, we can assist you in finding providers, but it can feel reassuring to students and parents to have some good options outlined ahead of time, just in case you might need them. This first option, you could contact your insurance company to ask for a list of providers or generate a list online through their website. This is not the most efficient way of doing things. So people who have tried this before will know you might end up with a really long list, like hundreds of providers, which is pretty overwhelming, and very little information about what they actually offer or where they are. Or you might get one or two providers, which is frustrating because it's typically not enough to choose from. So that's not the most efficient way. If you've done that already and you didn't get a good list, don't despair because there are many other ways to look. You might also use Google or a search engine to do a search in your area. Could ask family or friends who might have some good ideas for you. If you've already been working with a therapist or a psychiatrist and you won't be working with them moving forward, ask them to help you with identifying other good options moving forward. So this is something that every good and ethical provider should already be thinking of in terms of bridging your care and ensuring you have the resources you need moving forward, and you are entitled to this service. You've been paying them, so you you deserve to get what you need, and you shouldn't be afraid to ask for it. As mentioned earlier, you can always reach out to the counseling center too. We'd be happy to assist you with finding a provider in your area. But most people are going to search for a therapist or psychiatrist using a directory specifically designed for that purpose. As you can see from the small typeface on this slide, there are many of those these days. Some more sort of generalized ones, and then ones that are pretty specific with respect to therapist identities or needs that clients might have. So there are some wonderful options in here. This is not an exhaustive list by any means. These are just some of the most popular ones that we've used and that kind of tend to come up depending on student needs. One important note on out-of-state care, we'll cover this topic separately too, but it's important to know that mental health providers have to abide by specific laws regarding their licensure, just like we have to at the counseling center. Most providers are only licensed in 1 or 2 states, meaning they can't practice across state lines. So if you find a provider you like, it's important to ask them about where they're licensed. That could affect when you're able to see them. For example, if you might be traveling for a job or traveling around to see family, that can affect whether or not you're able to see that provider while you're in a different area. And getting licensed in a new state is a pretty extensive process, which is why many therapists are only licensed in 1 or 2 states. It's not as simple as just signing up. There's a whole paperwork and fee and continuing education process that comes along with that. So this brings us to what about telehealth, which is a very timely, very relevant topic and question right now. So telehealth refers to services delivered by telephone, smartphone, computer, tablet, wherein the provider and client are just not physically located in the same space at the same time. Telehealth has existed for some years now, but of course it's recently grown immensely in popularity due to circumstances around COVID-19, including quarantine and social distancing recommendations from the CDC. And it's a wonderful way of delivering care. Evidence shows that it can be just as effective as in-person therapy for a variety of concerns. Though it's worth mentioning, telehealth is not for everyone. So some people will find greater benefit from in-person work when that's feasible and safe, maybe particularly if you need therapy more than once a week, if you have a higher level of risk with respect to concerns and behaviors that you're having, or if you require collaborative care, for example, in the case of an eating disorder where you might be receiving a bunch of different services packed together, like individual therapy, nutrition services, meal support, those types of things. So it's not for everyone, but it is accessible and wonderfully efficient for a variety of concerns. To get started with telehealth, at minimum, you need a phone, although many clients and providers will prefer virtual or video sessions to a phone call. Gives you a little bit more input, can kind of give you more of a connection with your therapist. And for those sessions, you would need a smartphone, a computer, or a tablet, preferably a device with high-speed internet capability. You'll also need a private, quiet, and confidential space where you can have sessions, and you'll probably want to use headphones too. Those are super helpful with sound quality and with maintaining privacy and confidentiality too. And with respect to out-of-state care, telehealth providers are still bound by regular licensing laws pertaining to in-person care. So they can still only work with clients who are physically located in states where they're actively licensed. So important to ask any questions you might have about this during those initial conversations with a new provider. And that brings us to our next slide. So how you would actually connect with a provider. Once you've identified a few options for potential providers, the next step is to choose how you connect with them. And some of them will specify how they'd like to be contacted. So they might say email is best, or please fill out the quick contact form on my website. So if they've specified a preference, you should abide by their preference. Otherwise, you can choose to phone or email. Um, if you're reaching out via phone call, it sounds obvious, but make sure to speak slowly, clearly, leave your name, your number, contact information, and maybe times that they can call you back, and whether or not it's okay for them to leave you a voicemail. You can use email too. You might use both during busy times of year, just because it can take a few days for someone to get back to you. Even if you do email first, most therapists will want to talk to you on the phone before scheduling. And in terms of scheduling, it's a good idea for you to look through your schedule ahead of time so you know a few different days and times that you'd be free to meet someone. That can really cut down on phone tag, especially during those busy times of the year, and it can decrease the likelihood that you have a great conversation with someone you want to see for therapy, but then you find out that your availability doesn't match up with theirs. That can be frustrating. I would also mention that it's common to reach out to a few providers at once just to kind of increase the odds that you hear back from someone and give yourself some different experiences to sort of have and compare to each other. If you don't hear back from someone within a few business days and they haven't specified that they're traveling or anything like that, you should certainly follow up again. But if you don't hear back from anyone and it's been like a week or 2 weeks, move ahead with contacting other therapists, because there are definitely therapists out there with openings and they will want to be connecting with you. So if you reach out to someone and don't hear back, try not to be too discouraged about it. It can be frustrating, but there are many options out there for good care, and you deserve to get what you need. In terms of scheduling, you might also want to think about what you have in your day and if you would feel ready to do it after therapy, just sort of from an emotional standpoint. I think it's worth mentioning too for the email piece, just to remember that email is not the most secure form of sharing information. So definitely fine to mention a few things about your presenting concerns and any symptoms you're having, but probably don't want to go super far in depth via email and share a lot of sensitive clinical information. Most therapists offer a 20-ish, maybe like 20 to 30-minute free phone call to learn more about you and your needs. That's so both of you can decide if it feels like a good fit before you would schedule with them. So that's not your therapy appointment. That's not your intake appointment. That's kind of your introduction call to start learning a little bit about the connection between the two of you and to kind of clear up some of the more logistical pieces before you'd schedule an intake appointment. The call gives you a chance to ask any questions you might have for them about therapeutic style, experience, their approach, any therapist identity factors that might be important to you. You'll also want to go over logistical concerns like insurance, fees, how they accept payment. And you could decide to schedule an appointment after that phone call if it feels like a good fit. You could also keep looking if you're not convinced or sort of want to see if you might find a better fit. Most therapists will be prepared for that possibility that you're sort of researching or shopping around a bit, but it's also worth noting if you feel good after the phone call, it can be best to just grab that opening because people's schedules fill up quickly. And if you keep looking for too long, that could end up meaning that you don't get to see the person you most wanted to see. The process with psychiatrists is a little bit different, so they might just schedule you immediately, either on the phone or via their website or via email, without having that initial phone call to talk about fit. In terms of questions you might want to ask on that initial phone call, so of course you'll want to ask anything you need to know about insurance or payment and how they accept it. You can ask about sliding scale options. That would be a reduced fee for therapy, which is providers who work with students pretty often usually have some sliding scale capability. Sometimes it's based on income, sometimes not. Not everyone offers sliding scale fees, and even when they do, that provider might not have an open spot for a sliding scale client, but you can always ask them. You can ask about their approach to the concerns you're experiencing or what you might work on together. Cancellation policy, that's an important one. Most providers tend to have cancellation policies, and if you fail to cancel within that time frame, you can be responsible for most or all of the session fee. So definitely be sure that you're clear on that one. And of course, once you do schedule with a provider, it can be helpful to put those appointments in your calendar so you don't miss them. And as I mentioned before, you might ask them other sort of timely questions that are more relevant right now, maybe about their politics, or if they've specified an identity on their website, anything that's important to you. This is your chance to really advocate for yourself, and just practice that process so that you can get the care that you need and deserve. And then, of course, they'll have some questions for you too. So they might ask you about symptoms you're experiencing, anything you've experienced previously, treatment history, if you've seen a therapist or a psychiatrist before, what you're looking for from your therapy and experience, what changes you might like to see moving forward, what's causing you to reach out for support right now. If you've seen another provider recently, including at the counseling center, they might ask if you'd be willing to sign a release of information so they can speak with that person too and kind of bridge your care together, hear a little bit more from that provider's perspective, what you've been working on and sort of where they feel you are right now. And it's important to say too, if after the phone call, either you or the provider or both of you decide that the fit isn't quite right, you can ask if they have any ideas for someone who might be a better fit for you based on your concerns. So you might have just shared information about yourself that feels pretty personal. That can feel frustrating if it hasn't resulted in the right connection, but maybe they have a great list of options for you and the provider that's perfect for you is in that list somewhere. So they might be able to offer that over the phone or via email. And that can be a great idea to ask, since they're usually pretty plugged into the therapist community. And that brings us to the end of our presentation. So thanks so much for being with us today virtually. Contact information for the American University Counseling Center is below, again, for your convenience. Please don't hesitate to reach out if you have any questions or concerns or thoughts about the referral process or our services. You can reach out via our website or our phone number, which is monitored regularly. Thanks for being here. We hope this was helpful to you, and take good care.